coronavirus, a global pandemic. And to help me with it today is Dr. Kibet Peter. Dr. Kibet Peter is the team leader here at Nairobi West Hospital. He's also a lecturer at the University of Nairobi. Dr. Ari, thank you so much for joining us.
Thank you too.
Before we start the conversation, I'd want us to run through the statistics. According to WHO, 334,491 cases recorded globally as of today, 14,652 deaths. And I want us to focus on the recovery. We have 102,429 people who have recovered from this disease. So if I will just shift to you, Dr. Ari, to bring you in to the conversation. There's clearly stages to this illness. There are people who do not even need to go to hospital. So just take us through the stages and exactly what happens in our body when one is exposed and confirmed to have COVID-19.
Thank you, Carol. So basically, as we all are aware, we are on a coronavirus mode as a country. And internationally speaking, this is a disease that is quite devastating. Not because of anything, but because of the complications associated with the disease. If the virus gains access into the body, there are several things that would take place. Remember, this is a virus that is associated with the droplets. So basically, if you're coughing, sneezing, or you have a procedure that exposes you to literally, or even through saliva, you can actually have aspects of the droplets coming out of your body, and the person close to you then gets exposed. So the virus can easily be transmitted through person to person, either through contact or through the droplets. I know right now there's a lot of fear around the airborne component being a key exposure aspect to this virus. But I think what WHO has attempted to do is to demystify the airborne component, especially as a precautionary measure. I think it will be too much of us as scientists to start scaring the public that this disease is airborne. What is important is that the disease is droplet associated. But having said that, when the virus gets into the system, there are several stages that the virus goes through. Remember, the cell of interest is actually the cell within the respiratory system. So when the virus gains access into any of the areas that is associated with the breathing, and breathing starts right from the nose, you are likely to develop flu-like symptoms. And this tends to take place within the first 2 to 14 days. We know that the current incubation period is about 5 days. And people have given different values in terms of the incubation period. But basically, once the virus gains access into the system, you will have flu-like symptoms. A lot of times, a lot of us will have things that we would associate with our normal colds that we are used to. You would have a bit of fever, sometimes almost pretty low in terms of the grade of fever. You will have sneezing. Again, most of us will sneeze when we have colds. You will have a dry cough sometimes. Your throat can start soaring, it becomes a little painful. And these are all initial symptoms form. And the more severe form is where you have now the body's immune system getting overwhelmed. And this tends to occur within the first 3 days. Actually, we stretch it to the first 6 to 7 days. The first 3 days are critical, because that is the time at which the virus enters the system. It enters into your body through the cells within the respiratory system. There are receptors, actually we call ACE receptors, through which the virus gains access into the cell. Once inside the cell, it takes command of the cell. And that is how it starts using the cell for its own multiplication, destroys that cell, then moves to the other cells. So basically, as the disease progresses, it becomes more severe. It goes further down. Remember, if it was at the, within the upper part of the airway, now it starts gaining entry further down. And you start seeing now symptoms that would make one have problems with breathing.
When the patient goes for isolation, exactly what is it that is being done in isolation? What kind of treatment, bearing in mind that there's still no vaccine for coronavirus?
Basically, as a country, and I guess even internationally speaking, a lot of scientists are now trying to figure out what modes of medications one could go through. But I think in general, because this disease progresses from one level to another, for the milder cases, it is self-limiting. So the body will tend to fight. It would fight on its own, and recovery is pegged on one's immune system. For the second category, we would watch, support the patient as much as possible, because if they are exhibiting, let's take for example, difficulties in breathing, you can aid that component. You can give them some oxygen, you can expose them. But remember, we'll also be checking the performance of the lungs at that particular moment. Secondly, if they're having other symptoms, for example, some would actually come with even diarrhea or nausea or vomiting. So other medical complications would set in, and we are forced then to do supportive care depending on what the symptoms would look like. And here in our setup, if we think infections are setting in, then we would have to cover you broadly. We have different clusters of antibiotics that have been proposed. Now you can even hear of chloroquine coming into play. And basically, if you look at some of the drugs that are being brought into play or into use, it is because of the science behind the progression and the multiplication of the virus. Chloroquine, for example, tends to interfere with the pH within which the virus operates. So when you're given chloroquine, it disrupts that environment for the virus to multiply. And that's how chloroquine comes into play. Yeah.
Isolation at home, very briefly.
Yeah.
What exactly are we doing at home? When one is isolated at home, what measures are you taking to ensure that your family is safe, people you're living with are safe?
We recommend that you do not actually come into contact with your family members. If you have a room where you can lock yourself, a self-contained room, that we would encourage more often, because the intention is for you to be, at the least minimum, be in contact with anybody close to you. So you get isolated from the rest. You should have your own access to bathrooms, to facilities that you would be using. You would have to mask yourself if you have to come into contact with members within the family. The rest of the family should also take personal protective equipment to protect themselves against exposure to you as a person.
Older people have been said to be at a risk or to have higher risk of getting the virus. Why is this? Older people. And the myth about children, that children cannot get this disease. Is it a myth? Is it a truth? Just explain it.
Children in general are not as much exposed to viruses like the adults. So the immune system of an adult who has been exposed to other viruses is much more heightened than the baby. Okay? So when the virus gets into a child, the body's immune reaction is not as much and it is not as aggressive as in an adult, because the body's immune response also contributes to the disease progression. So in the adults, the disease would have more severe outcomes than in the children. Thirdly, the receptors that the virus uses in a child are still growing. So the receptor level or concentration is lower than in an adult. And I think this is the reason why, in children, the disease tends to be milder compared to the adults. Now, for the older population, the biggest challenge is that as we keep aging, the body's immune system also starts fading. And so, in terms of your response to the virus, it's a lot weaker. Again, we have people who have other underlying diseases, and this tends to occur in the elderly. You have sugars setting in, you have pressures coming in, you have heart problems coming in, you now have immunodeficient causing illnesses like HIV setting in. So basically, this particular cluster of people have their immune status relatively low. And so they get, as soon as the virus gets into them, the outcomes are not as good. We encourage masks to be used by those who have respiratory problems. If you think you're coughing, you have this sneeze, you have things that are not okay as far as your breathing aspects are concerned, you have a sore throat, mask. Because by masking, you protect the rest. Okay? The second thing is that for the clinicians who are working in a medical setup, masking is inevitable. And we encourage that if you're working in a hospital setup, do not just use any ordinary mask. Use a mask that protects you from the rest of the general public. The disease is a very expensive disease to manage. Take it from me. Right now, we've run short of disinfectants. We've run short of masks. So sooner, we'll be possibly recommending that someone tries to attempt to get some way of covering, themselves to protect themselves. So we need to take, at a bare minimum, the instructions that the government is doing. I know the government will be trying to protect all of us by limiting travelers getting into the country, us moving around unnecessarily, and we would only want to restrict movements to critical aspects of life that may be necessary. So I think the steps that the government is doing will help curb the disease as much as possible.
Dr. Kibet, asante sana. Thank you so much for your
Thank you
insights.
too.
That's Dr. Kibet from Nairobi West Hospital talking to us about COVID-19 and measures we must continue to take to protect ourselves and also contain the virus. That's it from me here at Nairobi West Hospital. My name is Caroline Kamau. Back to you in studio.